All right, we're back with another PCBH snippet. This comes from a presentation that Bridget and I just did to the WAMI Family Medicine Network about our PCBH curriculum within our family medicine residency program. And it's for all our behavioral scientist colleagues out there doing the important work of training family medicine physicians. One thing from the beginning we always like to say when we're talking about our curriculum is to make sure to prompt our behavioral scientist colleagues to recognize the moment that they're having. You're training future physicians, you're training future primary care providers. And that is going to ripple out exponentially. It's important work. It's work that we need to iterate constantly and always recognize the value of the work that we're doing. More though, the conversation that we were having during our presentation was about moving away from behavioral scientists solely focusing on training family medicine residents in behavioral health topics. For sure, there's some things that we're always going to make sure we want primary care providers to know about behavioral health, whether that be mental health conditions and concerns, substance use conditions and concerns, how to intervene and approach from an evidence-based perspective. For sure, there's components that we're always going to be focusing on training our future primary care provider colleagues on behavioral health topics. However, maybe it's more of an and. If we focus solely on behavioral health training within family medicine residents, being solely about behavioral health, that's finite. There's a limited amount of information that we're going to go over, which also ripples out to a limited amount of time that we're probably going to get with the residents. And if we would shift our attention for it not being solely about behavioral health, it was about healthcare delivery. Through and through. Our purpose, our opportunity, the trainings become infinite. So instead of it being solely about mental health conditions and diagnoses and interventions that could be provided, what if it was about healthcare delivery? How to interact with patients, person-centered communication, trauma-informed care. How to appropriately gather context from a patient and approach them from a contextual, curious, and compassionate lens. That is generalizable to any condition, any problem, anything that shows up in primary care. So for our behavioral scientist colleagues, thinking outside the box, how do we make our trainings and the things that we're asking residents to do within our behavioral scientist curriculum, how do we move beyond behavioral health and have it be a healthcare intervention? Thanks for tuning in.